my name is Hannah Garrett, and I'm going to be talking to you today about carbon monoxide and carbon monoxide poisoning. So carbon monoxide, or CO, is an odorless, colorless, and tasteless but dangerous gas. To emphasize the idea of carbon monoxide, I intentionally put an empty image on the left because it is colorless, and you cannot see it or smell it, which is what makes it so dangerous. Carbon monoxide is produced when fuels such as gasoline, natural gas, oil, wood, or charcoal are burned. Breathing CO reduces the blood's ability to carry oxygen, and it can reach dangerous levels both indoors and outdoors. I'm not going to read the entire list to you, but some sources include gas appliances, fireplaces, charcoal grills, and automobile exhaust fumes. Everyone is at risk for CO poisoning, but the highest risk would be for infants, the elderly, people with chronic heart disease, anemia, or breathing problems. Inhaling carbon monoxide fumes causes carbon monoxide poisoning. When inside your lungs, carbon monoxide can prevent oxygen from reaching your bloodstream. Many appliances and vehicles burn fuel that emit carbon monoxide. When people use and maintain these appliances correctly, the CO levels usually aren't harmful. CO poisoning happens when fuel burning appliances run without proper ventilation. For example, it can be dangerous if you left your car or truck idle in an enclosed space like a garage, have a vehicle with a blocked exhaust system, such as snow in the tailpipe, or use a kerosene heater or gas barbecue grill indoors. You should do a yearly inspection at the beginning of each heating season by a trained professional to inspect your fuel burning appliances in your home. You should also make sure that you are choosing appliances wisely. So if you have a fuel burning appliance, make sure that you're taking the correct precautions. Make sure that you install carbon monoxide detectors throughout your home, and make sure that you test them every 6 months and change the batteries every 6 months as well. Also, make sure that you have proper ventilation in the space. So whether that's at home or in the workplace, make sure that the ventilation's there and that it's clear of any debris. Please note that CO is not infectious. However, it is important to continuously monitor it for prevention. So for mild carbon monoxide poisoning symptoms, you may notice that they go away or reduce shortly after moving into an area with fresh air, or breathing in pure oxygen through a mask. It could take up to 24 hours for CO to leave your body, so your symptoms may persist. During this time, you may also experience lingering symptoms for up to 2 weeks after your exposure of CO. The most common symptoms of CO poisoning are dizziness, headache, weakness, upset stomach, vomiting, chest pain, and confusion. CO symptoms are often described as flu-like. So if you breathe in a lot of CO, it can make you pass out, and sometimes it can kill you. People who are sleeping or drunk can die from CO poisoning before they have any symptoms. So if you notice any warning signs or symptoms, go outside immediately and contact 911 or your local emergency service number. Don't stay indoors for a call to help. If you are unable to get outdoors safely, open a window or a door and stay by the open window or door while calling for help. So the bottom line is that carbon monoxide poisoning is life-threatening. After only a few minutes of exposure, it can be deadly. If you catch CO poisoning in time, treatment can reverse the effects. You may experience lingering complications to your health after CO poisoning, such as breathing difficulties, Parkinson's disease, memory loss, and heart abnormalities. So to protect clinic staff, what we're going to be doing is proper training on recognizing the symptoms, adequate ventilation in the clinic, installation of carbon monoxide detectors, and emergency response protocols. A lot of these are already in place, so we are doing good on that. And then some other considerations would be to educate the public on carbon monoxide safety, collaborate with local authorities or community awareness campaigns, and be familiar with legislations and regulations related to carbon monoxide safety. So that is all the information that I have. We are going to open it up for questions now. Thank you.